I'm Dan Kennedy in the 11Alive Streaming Center, and here is the latest health news that you need to know. We'll start with the Ebola outbreak in the Democratic Republic of Congo, now claiming the lives of 3 Red Cross volunteers who got the virus while conducting some humanitarian work back towards the end of March, though the workers just died in May. Officials say when the workers became sick, the extent of the Ebola outbreak had not yet been known. This news comes as World Health Organization has upgraded the Ebola outbreak risk in the Congo to very high at the national level as that disease is quickly spreading in Central Africa. The WHO says that the global risk, though, remains low, and health authorities continue to say this is not the next global pandemic. Jen Sullivan reports.
The Ebola outbreak in Central Africa is spreading rapidly and is now being described by the World Health Organization as deeply worrisome.
Welcome to our
Friday, the WHO holding a press conference where they raised the national threat level of Ebola in Congo to very high.
There are several factors that warrant serious concern about the potential for further spread and further deaths.
The global risk for spread remains low, but WHO officials are pushing for a global response.
This is one of these situations where it's sort of an all hands on deck, and we want to make sure that everybody is coordinated in their action and working together.
Unlike the more common Zaire strain, this particular strain, known as Bundi-Bujo, is extremely rare, and there's no approved vaccines or treatments.
It's a disease that, generally speaking, is very dangerous because it's a virus that multiplies very rapidly, instantly. It's very rapid.
As a precaution, the Centers for Disease Control and Prevention this week issued a 30-day travel ban for non-U.S. citizens and permanent residents traveling from Uganda, South Sudan, or Congo. And any U.S.-bound flight carrying passengers who were recently in an Ebola-affected region of Africa will land at airports in Atlanta, Houston, or Dulles outside of D.C. to undergo health screenings.
We can't have it affect the United States. We can't have Ebola cases coming here.
I'm Jen Sullivan reporting.
I spoke with MG Finn from Georgia Tech to learn more about the global health preparedness for this moment and what people should know about both the Ebola and hantavirus risks.
Well, the risk is low for both of these cases, so I would want people to be reassured in that context. But I'd also want people to be made aware that our general ability to respond to these kinds of challenges, and they will keep coming because that's what viruses do, our general ability is seriously degraded by the cuts in CDC and our withdrawal from the World Health Organization. But for these 2 viruses, right now, people in the U.S. should not be worried. Should be aware, but not worried.
Okay, so let's dive into that a little more about our preparedness and where you find us right now compared to, say, at the start of COVID.
Sure. So actually, a good example is the most serious Ebola outbreak in 2015-2016, in which the CDC had people on the ground in Africa right from the start, which the infrastructure there was much better developed. And we were there to help figure out what was going on and to coordinate responses. And that ability of the CDC has been seriously undermined. And unfortunately, it's a short-sighted posture because, of course, viruses can be transmitted and can travel all over the globe with modern travel abilities. Viruses keep mutating. There's nothing wrong with that. That's what they do. And we had built a very strong infrastructure to monitor and deal with these kinds of challenges. And we need to rebuild that.
Georgia health officials so far this year have confirmed 5 measles cases in the state. All of last year, Georgia had 10 confirmed cases. These new measles cases are from one Metro Atlanta family, and state health officials say the family was not vaccinated and had recently returned from traveling internationally. Georgia's case count is still small, but now health officials are working to track down anyone who may have been exposed as they return home and develop symptoms. We spoke with Ben Lotman, the professor of epidemiology, global health, and environmental health at Emory University, to learn more about what we all need to know.
These cases are not a reason to panic, but they really are a reason to pay attention to what's going on. And Georgia has, as you said, a relatively small number of confirmed measles cases. But the reason that measles is so concerning is that it can move fast. It's one of the most infectious viruses that we deal with. The cases that have been observed so far, that have occurred so far in Georgia, they fit a typical pattern of unvaccinated individuals who often have international travel to an area where measles transmission is occurring. They get infected and they bring the virus back, and that seems to be what's happened in this case. And the Georgia Department of Public Health will have snapped into action now to identify people who've potentially been exposed and to monitor them for the appearance of ongoing cases.
You know, May is Lupus Awareness Month, and Black and Latino women continue to face some of the highest risks from the disease. Lupus affects some 1.5 million Americans. Black, Hispanic, and Native American women make up the majority of those cases, and that health disparity can also lead to delayed treatment and higher mortality rates. Now, one recent graduate of Morehouse School of Medicine is tackling that issue by turning her own experience into a new mission to help others. 11Alive's race, culture, and religion reporter Danielle Nottingham has her story.
For Tifton native Dr. Nia Oglesby, lupus became more than a diagnosis. It became her purpose.
My family and I had to drive over 3 hours for me to receive treatment in Augusta. That was the nearest specialist that was available at the time.
The recent Morehouse School of Medicine graduate was 12 years old when she learned she had the autoimmune disease where the body mistakenly attacks healthy tissue and organs.
I was in so much pain. My grandmother and my mother would have to carry me to the bathroom. We would try to go to the emergency room back home, but they didn't understand what lupus was, how to treat a child. What are we supposed to do?
According to the Lupus Foundation of America, lupus is a top 10 cause of death in Black and Hispanic women ages 15 to 44. And Black women with lupus die up to 13 years earlier than white women.
For a lot of us, it's hard because we are often dismissed or there are often delayed diagnoses what patients face.
Oglesby now wants to take her personal experience and become a pediatric rheumatologist.
Being aware of the health inequity that existed within my community is what inspired me to want to go to medical school and become the doctor that I once needed.
Danielle Nottingham, 11Alive News.
Atlanta is one of 5 cities to lead research on this area at Grady, and once she's done her 2 residencies, Oglesby hopes to dive back into research to help find a cure. And we have more new health news after this short break. We're back here on 11Alive. You know, summer is here, and for millions of families across the country, that means more downtime, more boredom, and yes, more screen time. But a growing number of parents now pushing back on that screen time. Concerns about social media, mental health, cyberbullying, and online safety fueling a nationwide movement to delay smartphone for kids altogether. Emily Body, the co-founder and co-lead of Smartphone Free Childhood USA, spoke with 11Alive's Savannah Levins about the growing push for change.
We saw when Jonathan Haidt's book came out, The Anxious Generation, it really galvanized a movement. It gave language to parents who were already instinctively feeling a lot of these things, that social media was having a negative impact on mental health, that constant screen use was really impacting children's capacity for attention, right? These short form videos and things like that. We are seeing parents band together, right? So John Haidt talks a lot about how we need to have collective action solutions for these collective action problems. And so parents are coming together. They're coming together through our network as one way to discover best practices, to share resources, and really start confronting these issues. Delaying smartphones is one of the things that we advocate for. We advocate for parents starting with landlines, giving their kids healthy and safe ways to communicate with each other. And we also advocate for other norm changes around digital technology use. So moving to a more intentional use of technology overall.
Memorial Day marks the start of what's historically been called the 100 deadliest days of summer. It's a time that stretches from Memorial Day through Labor Day, with the number of fatal car crashes significantly spiking for teen drivers. And for many parents, it's a time when they look to see how they can keep their kids safe. It's never easy turning over the car keys to your child, but this time of year can be especially concerning, as the next 100 days are considered the deadliest for teen drivers.
That's when teens drive more, they have more free time, and they're often driving in higher risk conditions.
Jonathan Hassani with Johns Hopkins Bloomberg School of Public Health says any new driver, regardless of age, is more prone to car crashes, but inexperience is just a part of what makes driving riskier for teens.
because their brains are still developing and they have more difficulty calibrating risk, frankly.
Teens between the ages of 16 and 19 have a fatal crash rate almost 3 times higher than drivers ages 20 and older per mile driven. While car crashes are a top cause of death among teens year-round, they do tend to spike in summer, rising by 30% between Memorial and Labor Days. Not using a seatbelt, distracted driving, speeding, substance abuse, and having teenage or young adult passengers in the car, all factors that also raise a teen's driving risk.
In addition, driving late at night, particularly between 9 p.m. and midnight, is associated with an elevated crash risk.
To reduce risk, parents can monitor their teens' driving, set clear rules and expectations like always wearing a seatbelt and not using the phone, also not driving with other young people in the car, and choosing a vehicle with safety features.
Crashes are predictable, they're painful, but they're preventable.
The U.S. Centers for Disease Control and Prevention also has a form that parents can print out and teens can sign that puts a family's rules of the road in writing and clearly sets those expectations and limits ahead of time. For more information, just log on to cdc.gov and search for Parent-Teen Driving Agreement. With school out for the summer, doctors say that summer fun for the kids can quickly turn into ear pain, like swimmer's ear. Sometimes plane pressure can turn painful. Even loud concerts and, of course, all the fireworks. There are some simple steps that parents can take now to protect their children's hearing. Dr. Timothy Ryan with WellStar breaks down what families need to know.
When we talk about summer ear issues, we talk about hearing loss from fireworks shows, loud concerts, sporting events, and then we can also get infections in the outer ears with things like swim teams and lake swimming.
And so how quickly can a fun day at the pool turn into painful ear problems? Because pool days, I mean, kids can turn into a raisin out there. They don't want to get out of the pool.
Pretty quickly. So what ends up happening is you can get some water down in your ear, and our ear is pH balanced. And what that means is that there's a level of bacteria on each side that is in balance that needs to make sure that our ears stay healthy. If we get water, or pool water, specifically with a lot of chemicals, it'll throw that balance off. And within a couple of hours, that bacteria can overgrow, start to cause ear pain, swelling, and drainage.
More health news after this. You're watching 11Alive. You know, mental health care can often come down to a simple question. Can people actually get to it? In Metro Atlanta, a new initiative is trying to answer that by removing some of the most basic barriers for low-income and uninsured patients. The work is being led by Sustento. Founder and CEO Joe Agoto spoke with our Cheryl Preheim about the plan.
It's a really important issue. According to data from Mental Health America and the U.S. Census Bureau, Georgia faces a severe mental health crisis. They rank 47th nationally in access, and 34% of adults cite barriers to reaching mental behavioral health care in the state. I believe there's no doubt that is because Georgia also ranks among the top of uninsured individuals in the country. Roughly 12% to 13% in Georgia lack health insurance, and that's way above the national average. And that tallies up to 1.2 million Georgians who, under the age of 65, are living completely without health insurance. And when you're uninsured, your ability to access not only primary care, but mental and behavioral health care can be incredibly difficult. Even getting transportation to reach charitable care services that might be available for you can really disrupt your continuum of care. And getting through the maze of paperwork and qualifications can be incredibly difficult. And I think we all know, even if you have health insurance, it's a challenge. And that's the work that Sustento is doing, the nonprofit I lead. We are focused on removing barriers to care for uninsured individuals nationally. We've been doing this since 2019, and Atlanta has been a big area where we've been doing this work. We have been partnering with free and charitable clinics, community clinics across the metro area to help remove barriers to mental behavioral health care.
You know, with election season underway, many Georgia voters say affordability and access to health care are on the ballot amid hospital closures, worker shortages, and lack of resources. Our Joe Ripley takes a look at what the state has done to address these issues and what work still needs to be done.
Juliana Ferrone will never forget the day in July 2020 she felt the bloating, back pain, and abnormal bleeding. The day that changed her life forever.
I was 27 years old when I got the news that I had cervical cancer.
A gut punch for the Conyers native who lived in Opelika, Alabama at the time, drove 70 miles one way for care, and then moved to LaGrange to get closer to the City of Hope Cancer Center to get treatment.
Where you live should not affect whether you live or not. It's extremely frustrating when you spend so much time looking for treatment, because when you're sick, you don't have the energy to do so.
Natasha Taylor, Deputy Director of Georgia Watch, says a lack of access to health care continues to plague the state.
There's already an issue in rural Georgia with provider shortages, hospital closures, transportation, getting to care. So now you're talking about I can't even afford care as it is.
Taylor says Georgia lawmakers have made strides, such as creating more residency slots, plus an easier path for internationally trained doctors to get their license here, limiting use of artificial intelligence in insurance coverage decisions, and preventing surprise ambulance billing. Taylor says she'd like to see more transparency in healthcare pricing and certification of community healthcare workers to address the provider shortage.
They have to make a choice between paying their rent or paying to put food on the table and paying for health coverage.
After 27 rounds of radiation every 21 days for over 3 years, Juliana Ferrone now advocates for early screenings, along with accessible, affordable, and preventative health care.
We're literally talking life and death here. You know your body. You know when something's not right. And when you get such a earth-shattering diagnosis like that, you got to be proactive and advocate for yourself and your health.
Construction is one of Georgia's fastest growing industries, accounting for more than $80 billion while supporting about 250,000 workers across the state. But behind that growth is a workforce under increasing pressure and mental health becoming a big focus for the construction industry. 11Alive Cheryl Preheim spoke with Bill Anderson, the president and CEO of the Associated Builders and Contractors of Georgia, about the push to bring mental health resources to job sites.
We've been addressing mental health for many years in the construction industry, but we really wanted to focus on this, especially since May is Mental Health Awareness. And one of the things everybody thinks about in construction is safety on the job site, safety goggles, hard hats, gloves. But we are really focusing on the whole body mental health, and that includes mental health issues that we can help within our industry and the workers. Construction can be challenging at times on job sites. There's large equipment, there's tools, and there's, dangers, obviously, for safety reasons. But if a worker comes to the job site as having mental health issues, it's not very apparent. It's kind of like a silent epidemic with depression and anxiety. And if they're not focused on their job, it's not like going into an office, job, make a typo or send the wrong email. On a job site, it can be really affecting other workers. It can be safety issues. There can be injuries. So we really want to see that all our workers are coming to the job sites and don't have any mental health issues. The construction industry has been typically, it's a tough guy stereotype. There's more women coming into the industry, but it is a male-dominated industry, and so there's a lot of long hours on job sites. Some of the job sites, Cheryl, may be far away. Workers have to drive a long way, or they may be away from their families the entire week because the job site may be hours or even in another state. And that can bring mental issues and other areas that need to be addressed with our workers, not just the physical well-being, but to ensure that they are mentally well-being too.
Well, summer is unofficially here, and with it comes an increase in alcohol consumption. But researchers say that many younger adults aren't aware of the long-term health risks often associated with excessive drinking. It's no secret alcohol isn't good for your health, but researchers say one risk is flying under the radar.
Most American adults just aren't aware that alcohol increases the risk of cancer.
Researcher Darren Mays with the Ohio State University Comprehensive Cancer Center says drinking alcohol is linked to an increased risk of at least 7 cancers: colorectal cancer, liver cancer, mouth cancer, cancers of the throat, voice box, and esophagus, and the most common alcohol-related cancer among women, according to the CDC, breast cancer.
We've done research on our own in young women focused on breast cancer and found that less than 1/3 of young adult women recognize that drinking alcohol increases the risk of breast cancer.
Mays says there's been decades of study into how things like diet, smoking, and physical activity can impact cancer risk, but he says awareness and research are lacking when it comes to the risk of cancer from alcohol.
Drinking at an earlier age puts young women at risk, not only of a higher risk of lifetime breast cancer, but also what we call early onset breast cancer.
Part of May's research is how to better get the message across. To do that, they're getting input from young women.
What kind of messages would capture their attention and lead them to think more about their drinking behavior and potentially change their drinking behavior.
Dr. Mays says the cancer risk is influenced by a number of different things, alcohol consumption being just one factor here, but others include genetics, environmental exposure, and other lifestyle choices. But he says that drinking less or not at all can reduce a person's risk of developing cancer. And thank you for joining us here on 11Alive with your health news. I'm Dan Kennedy, and we have more news on your way coming up next.